So I'm a research fellow with the Department of Orthopaedic Trauma at the University of Alabama at Birmingham. And this presentation is about outcomes of stage fixation of transverse posterior wall acetabular fractures. So transverse posterior wall fractures are a type of fracture of the joint surface of the hip socket. And these injuries specifically involve a fracture transversely across the socket in the axial plane and of the posterior part of the socket in the sagittal plane, which is shown in the picture on the slide. They're usually caused by high energy mechanisms such as car accidents, and they generally require surgery to reduce pain, stabilize the hip and pelvis, and prevent the onset of arthritis. Typically, these fractures are managed with open reduction, internal fixation. The fracture is approached posteriorly by splitting the gluteus maximus and dissecting the deep muscles of the hip to access the posterior parts of the acetabulum and implant plates and screws. And in some cases, a single posterior approach is not enough to sufficiently access and fix the entire fracture due to neurovasculature limiting dissection. So an anterior approach must also be used for greater exposure. The use of multiple approaches is called staging and can be done by re-prepping the patient under the same anesthetic, or the patient can be taken back on another day. And depending on the fracture pattern, different anterior approaches can be used. And each approach risks damage to different structures such as the bladder, peritoneum, spermatic cord, round ligament, and neurovasculature such as femoral, iliac obturator, or superior gluteal nerves and arteries. Despite the risks involved with these procedures, there's not really any consensus right now on which approaches to use based off different patient characteristics or different injury characteristics. So the purpose of this study is to analyze the outcomes of staged versus non-staged fixation of transverse posterior wall fractures in order to help guide surgical planning. So this is a retrospective review of adult patients with transverse posterior wall fractures treated with open reduction internal fixation at our hospital. If 418 patients were included, 13 were stage and 405 were not. As far as results go, stage cases required more transfusions, ICU admissions, and revision surgeries, and also had longer lengths of stay, higher incidence of wound dehiscence, surgical site infection, and heterotrophic ossification. And this is the formation of bone in non-bone tissue and can lead to loss of range of motion, pain, and skin lesions as well. So given these differences in outcomes, we recommend judicious use of stage intervention for these type of fractures. However, one of the major limitations of this study is selection bias, because worse fractures tend to be more staged, or surgeons are more likely to stage worse fracture patterns. So the analysis is also limited by the different sizes of our groups. We only had 13 in the stage compared to 400 in the not stage group, which leads to bias. So what we're doing is doing a matched analysis where we're matching each stage patient to 2 non-stage patients based on their characteristics such as age, BMI, comorbidities like injury severity score, which is basically how many systems in their body are injured and things like that. And then we're going to also match them based on fracture characteristics in order to get a better comparison. And preliminary data from this analysis actually shows similar outcomes between groups. So that shows how that selection bias on results. And in the future, a randomized prospective trial will provide the best evidence and guidance for study. Thanks for listening.